most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together we
therapist.
are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about what is causing your hip pain. We've done a series of videos like this on what is possibly causing your hip pain. Today, we're going to talk about tendonitis and how to know.
Right.
It can be very difficult to assess tendonitis.
Right.
And there's two muscles that tend to be the problem, but we're going to give you some clues and we're going to give you some tests. So first of all, what is tendonitis?
You're asking me?
No, I'll tell you if you want me. So you have a muscle that narrows up and it becomes a tough fibrous cord that attaches to the bone. That's how
Which is the tendon.
Yeah, which is a tendon. That's how muscles attach to bone. So those tendons over time, if they get worn or they're going over a bone, they can become frayed or degenerate and wear down and become inflamed, which it becomes
Itis.
itis, right? So it becomes tendonitis,
Right.
And unfortunately, the tendons have poor blood supply, so they heal slowly.
Right, and that's why they're white in color, because they don't
Sure.
have a lot of blood in them.
I never thought of that.
But
Brad.
that's how I remembered it.
Yeah,
They're
cool.
very tough, though.
Yeah, they're very tough. So anyway, tendonitis often occurs with an increase in training or exercise. So like if you're getting into something too quickly, too fast,
Right.
and you're not incrementally going into it.
The other one, particularly with hips, if, say you got hip pain on your left, possibly tendonitis, it might be because maybe your right knee or ankle or something on your right leg is irritating you, so you start walking differently, you're limping, and that can also cause it.
Yeah, our body is an amazing thing. They adapt, but they also can
Wear
down. Yeah. So training things like walking upstairs, high-level cycling, sprinting, kicking, jumping, squatting, especially the HIIT workouts, high interval.
Sure, that you're really putting
high
some stress
intensity
on.
interval training. Spin classes, Stairmaster, would obviously be a one that would do it.
Right, where you're really lifting up.
They still have
particularly.
Stairmasters, Mike? They do.
Oh,
Okay.
yes, Bob.
All right, just the revolving ones.
Ooh.
Okay. So two common muscles are the iliopsoas. These are both hip flexors. They flex your hip.
So lift your knee up in the air.
And the rectus femoris. Rectum died never killed them, right?
Oh,
Is
Bob, why,
okay.
Bob? So should we talk about the iliopsoas?
Sure.
That's a real common muscle that, as therapists, we think about it, and I think people are more aware of it. But it's a deep muscle.
Yes.
It's really it's in the abdomen, underneath the intestines, if you will, the inner parts, the visceral parts, and it connects to the back.
The transverse processes here, little bumps, like I think all 5 of them, I believe.
Yep. From the spine, the side of the spine, as well as the ilium or the
fossa.
pelvis right there. And then it comes down over, and then the tendon part is right over the
hip,
hip joint.
And that's where the problem comes in, and it attaches to the lesser trochanter here, the bump here.
Yep.
But that's where the problem is. If your hip is a little bit, let's say, sloshy.
It's
moving.
not,
it's moved forward a little bit, which is quite how it happens quite often with a weak glute.
Sure.
If your glute maximus is weak, that hip doesn't stay in place like it should. And that can cause that increased tendon or increased pain on the tendon, increased stress on it.
Sure.
And it can actually cause it to snap, too, kind of snap over your hip.
Yeah, you get that clunking when you lift up. My sister had that clear. I could hear
Did
it.
she?
Yeah.
So that's snapping hip syndrome.
Right.
So
hers wasn't real painful, but you could hear it.
Sure. Now the the rectus femoris, the rectus femoris actually comes from this bone right here.
So that's, you would call it the pelvis. It's technically
we're
it's
going to
the
show you how to
ilium.
find that on you because you want to know where that is. And actually, it's going to attach into the rest of the quadriceps. It's one of the part of the quadriceps.
Eventually, the ultimate end of it goes to the kneecap.
Right.
That's
But this is where the tendonitis occurs. And this is where the tendonitis occurs down here.
Sure.
One of the first tests we do is actually called, we're testing hip flexion.
Sure.
Basically. So we're putting the muscle under stress and the tendon under stress.
So, and the therapists call it a manual muscle test.
Right. Very easy to do.
Yep.
Just you're going to lift one side. Probably do the side that's not painful first.
Right.
So you compare. And push down on it as hard as you can and resist it.
Yep. Lift up 3 inches, hold it there, push down, and see if it hurts.
Right. And compare it to the painful side.
Right.
And if that one bothers you, it's one possible sign that, you could have tendonitis, you could have a tear too.
Right,
But-
right.
So number 2, we're actually going to have you try to, using your hands, palpate a little
Right.
bit. And that's where you're going to have to watch this real closely here. I'm going to move my fingers along the pelvis here, so you're going to have to find your pelvis.
Yeah, I'm gonna kind of.
Sure.
Yep. So you can find that bone up here,
Right.
and right where Bob is feeling. Let's kind of
And
turn sideways.
the first bump that you find right there, that's where that tendon attaches, the
Yep.
rectus femoris. Now you go 3 inches below that.
It doesn't have to be exactly.
No,
true.
exactly.
You know, 1, 2. So we're looking right down in
And
there.
then rub across there and see if it's tender there. And if it's tender there, that's the rectus femoris tendonitis.
To get into the iliopsoas tendon, you really gotta get in
it would
deep.
it'd be right over the hip itself. And now the hip is not, don't think over here, think over here.
Right, we're on the
And
front part of the hip.
Pretty tough to tell. The last test you can do is actually put these muscles on stretch a little bit.
Sure. Yep.
So what you're going to do is I'm going to test this one here, and I'm leaning forward and stretching it.
Yep.
And if that hurts, another sign that you might have tendonitis.
In the location of the pain, if you feel it more in the same locations we just mentioned.
Right. And it kind of recreates the pain you've been feeling.
Right.
You know,
there you go.
So you can obviously test both sides. It's going to go like that. And I'm keeping really good posture while you're doing this. I'm not going like this.
Right. And
I'm
make
really
sure
stood up straight.
you're consistent one leg to the other as far as your posture.
Right.
So yeah, again, comparing the good side to the bad side is always it's what therapists do all the time.
Right.
You know.
And lucky for you, we're actually doing another video on the top 5 treatments for hip tendonitis.
Exactly.
So that'll be coming up. So watch for it. Remember, this is actually, you maybe not know this, this is part of a series of videos on hip pain. So all you have to do is go to bobandbrad.com, go to the program section. I was going to say giveaway.
Click on that.
Click on that and look for, we have different titles, sciatica, plantar fasciitis, and look for the hip one. And we'll have a whole series of videos you can look at, absolutely free, no sign up for it.
And there's a PDF printout,
Yeah.
so you can print out notes from the video. I mean, it's a heck of a
Why
deal.
am I kneeling down here?
I don't know, Bob. I thought maybe you were going to
I didn't want
propose
Mike
or
to go,
something.
I didn't want Mike to go, lose my head here. So, all right. Thanks everybody for watching.